ஜாயின் ஆமா கொஞ்சம் லேட்டா தான் ஜாயின் பண்ணேன் நான். ஃபர்ஸ்ட் ஜாயின் பண்ண எல்லாரோடமே இருக்கு. 3 பேரோட வந்து இல்லையா மேம். மத்த எல்லாருமே வந்து
Can we start? Do you have any doubt? Did you practice? Okay, only 23 of them are there. Like, do you want to wait for some more time for others to join? Okay, maybe we will wait for 5 minutes and see.
Okay, Miss.
Okay, Miss.
Okay, students. Like, did you all try to practice the technique?
Yes, Miss.
So, any doubt?
No, Miss.
No. So now what we will do, we will divide you into 6 groups. Okay. So I will divide you into 6 groups. So we have nearly 6 classification. Okay. So that's why I divide you into in 6 classification. Touch is not like it's not much. So I will divide you into 5 groups, break rooms, and I request you to practice that particular technique. For example, group 1 will be practicing touch and effleurage. Okay, then after 15 minutes, I will open up the break room, and you are supposed to demonstrate how this touch and effleurage is done. Is that clear? So like that, second group will be doing on petrissage. Third group will be doing on friction. Then fourth group will be doing on percussion, and fifth group will be doing on vibration and shaking. Is that okay? So I will divide into break rooms now, and I will make you into 5 groups. So now the time is 2:10. So I want I will give you some 15 minutes time to practice. So 2:25 you need to demonstrate. So once I divide you into group, you make a leader in that particular break room. So in case for example, Petrosach has 4 subdivisions. So in that case, 4 of them can demonstrate each technique. Is that clear? So like that, like each group people have to demonstrate that so that I can watch you in video, and I'll be able to correct if you have any doubts. So before going into the sequence and other things, if we are like well versed with the technique, then it will be easy for us to go for the further. Is that clear? So now I'm going to divide you into break rooms. So each room will be having 6 people. Is that clear? So each room will be having 6 people. So I'm going to open the break room now. Everybody, please join in the break room. Okay, so everybody please on your video, then discuss. Don't just be blank. Okay, so I think only 5 people are there. No problem. You on the video, then you have to practice touch and effleurage.
Okay.
Okay, so can we start? Group 1. Group 1. Uh, maybe the group leader can open up your video, or if all the group members want to open up the video also can. Then you can demonstrate one technique. Group 1. Yes, group 1.
Yes, yes, yes.
So you
Now
can
open video.
yes, you open the video and you demonstrate. Ah,
I'm group 1. I'm doing the touch first.
yes.
Touch is to spread the lubricant to the body parts. Then we can do from proximal to distal or distal to proximal, and don't keep parts is
You can just demonstrate on the pillow.
now I okay, I do it. I touch so proximal or proximal to distal, and don't leave any body parts. That is touch.
Okay. So this is one way. Again, it depends on the body part you are touching. So you can use all the hands with closed also. Okay, so you can if it is like a back, if it is like back, then you need to use the whole hand so that you will be able to touch the whole area like this. Is that clear? Can you see it?
Yes, yes.
So if it is like face, then you can touch like this so that the lubricant, it is easy for you to spread. So depending on the area, for example, if it is only for upper limb, then you can touch like this. If the body part is bigger, then you can go for closed fingers. Is that clear? Okay. So next, effleurage, who is going to do? Please don't waste time. Okay.
Miss, I'll be doing effleurage.
Okay.
So effleurage, there's deep stroke and superficial stroke. So for the beginning, I'll be doing this will be the back of the patient.
Okay.
So for the beginning, I'll be doing superficial deep stroke first. So deep stroke, I'll be following the course of the vein and also the limb, and then towards the heart. And then after that, I'll be doing the superficial stroke back to where I started. And just repeat deep stroke and superficial and then deep and superficial.
Okay, so here only changes the stroking. Normally it is always from proximal to distal. Okay, so you start from proximal and you do distal. So it will be like this. Is that clear? Start from proximal and do distal. Then when going back, you will be going back without lifting the hands. But only thing is you will not apply pressure. So this is your superficial stroke. Going back will be very mild. Then again stroke. Going back will be mild. Then next area. Then next area, like that. Is that clear? Okay. So deep also same thing. Only thing is the pressure difference will be there. Okay. Okay. So next, effleurage, who is going to do? Effleurage from the same group. Who else were there in the group? See, don't think that like what will happen if you do it wrong. It is nothing to do it wrong. You are going to do for the first time. So definitely you will be learning from your mistakes. Okay, so you will not be able to do perfectly on the first time. So why I want to see you is so that I'll be able to correct it. Later on, like we will not have much time to look for the individual performance. Is that clear? So that's why I want to correct from the beginning itself. So don't hesitate. Don't feel like as if what others will think. Nothing wrong in doing it wrongly. Definitely there will be some mistake. Is that clear? And we all learn from our mistakes only, not only you, even like myself also. Everything we learn from the mistake. Is it clear? So, yes.
I will do for the thumb effleurage and also the forearm lah. For the thumb, just do like do thumb like this.
Okay.
Then for the forearm, we use here to like this.
Okay, no. This is like, this is not forearm. Forearm, you need to use the complete one.
Oh, so this.
No, yes, the complete forearm you have to use.
This
No, you have to drain like this. Actually, like I didn't teach you effleurage like this, right? I only taught your hand, like only hand effleurage, right?
Yeah, yes.
Okay. So, let me just share you the screen. 1 minute. Can you see? This is your touch. So you will be touching using the complete hand. Okay, so superficial touch will be, the pressure will be very less. Deep touch, the pressure will be more. Okay, that is the difference. So in effleurage, if you see, that day I taught you only two-hand effleurage. So two-hand effleurage will be like this.
Okay, okay.
Can you see my video?
No, Miss, no video.
Alright. Okay, 1 minute. Okay, so if you see here, I'll take a paper. So in effleurage, we have 5 different types. That is one hand, two hand, then we have forearm, fist, and ulnar, thumb and ulnar. Okay. So one handers depends on the area of the area surface area. You are going to choose the different types of effleurage. But all the types of effleurage, the effect is only one. You are going to drain the fluids. Is that clear? So for example, if this is your hand, then if it is your hand, then you can use a single hand and you will be starting from distal, then you will be pushing the fluid, then at the end of the lymph node you will be draining it. Okay, so from here you will be pushing, then at the end of the thing you are going to drain it.
Okay.
Okay, so at the end of the thing you will be draining the fluid. This is single hand. So double hand, for example, for back. So when the area is very big for back, you need to use double hand. So if this is your distal part and this is your proximal part, that is neck part, then you will be starting from here using your both hands. You drain the fluids, go near the lymph node, then use your thumb to completely empty the fluid. Okay, so from here you will be going down and you will be empty the fluid. So this is your double hand. So when you do like this, like returning back, you have to come without pressure. Then you will be going to the next area. Then you will be coming back. Then you will be going to the next area. Then you will come back. So this is your double hand effleurage. Then ulnar is using the ulnar side. So using the ulnar side, you will be doing like this. So keep your hand in a mid-prone position. Then use the ulnar side, then you have to drain it. Again, everything is from distal to proximal. You will be draining into the lymphatic channel. Okay, so like this. Then thumb is like she demonstrated already. So use two thumbs, then you have to drain the fluid. So here in this thumb is like if you are doing it on the palm. So for example, if you want to drain the lymphatic fluids from the palm, then you have to use the thumb, then you can drain into the wrist like this. So is it clear? So depending on the surface area, you choose which kind of effleurage you want to do. The next is like forearm. You have to use the complete forearm. So use the complete forearm, then you have to drain. Is that clear? So this is your forearm effleurage. So then last is like fist. So fist is, you can make it like a fist, then you can use like this, then you can push it. Okay, so the effleurage, all the effleurage from should be from distal to proximal, and you need to drain it towards the lymphatic channel, and you have to do both forward and backward. When you are coming back, you should not give any pressure. So this is the technique for effleurage. Is that clear? Okay. So can we go to the next group? Group 2. Group 2 will be doing petrissage. See, don't waste time. I want to go, like I thought to teach facial massage today. So make it fast. You want me to call by name? How long you want to wait?
Hello, Miss.
Yes.
We are group 2, but I thought we are doing effleurage, so we did not do the petrissage. We thought group 1 was having touch, and then we do for effleurage.
Okay. So like the whole group did not practice any other.
Yeah, we just look for effleurage.
Okay. So the group 3, you'll go with group 3. Group 3, what did you practice?
We practice for friction.
Actually, you are supposed to practice which one?
Plus, I remember just now you said for group 1 start from effleurage, then coming
Okay.
to petrissage.
Okay. Demonstrate, no problem.
So group 3 going to do petrissage or friction.
Anything, like whichever you have practiced, you can demonstrate.
Then we go for friction.
Okay.
So for friction is doing on the bony structures.
Hmm.
I use my hand.
Yes.
So
Yes, you can.
for friction, we go for thrombus. Is either side to side or up and down, and another is circular motion. Yeah.
Okay. Okay. So only thing is you can use your thumb so that like you will be able to apply the pressure properly. Okay, but the technique is correct.
Okay,
Okay,
miss.
next person. Next person. Anybody practice Petrissage? Percussion or percussion? We have 3 more technique, right? Percussion, Petrissage and vibration. Nobody has practiced that? Other groups? Okay, see, when I give time to practice, you're supposed to practice. If you don't practice, then like you are going to lose. Is that clear? I'm not going to lose anything. I can just teach and go, but I want to know how much you have understood, because like everything we are going to do online. So if you are just silent like this, then I will not know how much you have understood. I will not know how much to teach again. Is that clear? So I will give you another 15 minutes time. Now the time is 2:48. So sharp by 3 o'clock, I will again close the break room. So I will divide you into three groups. So one group, Petrissage. Group 2, that is room number 2, will be percussion, and room number 3 will be vibration and shaking. Is that clear? So I hope everybody are clear. So again, I am going to divide you into break rooms.
Miss, just now we are group 5. We have practiced the vibration and shaking.
Okay, then you can demonstrate, no problem.
Miss, I am in group 5, so I'm going to show the vibration. So vibration, when we are doing the vibration, our hand should be straight. We need to use the shoulder force to do it. So our hand will be straight. So that we depend on whether we need to do a superficial or deep surface. So we'll decide the force we use. If we need to do the superficial, we'll need a lesser force, and deep surface will need a more force. So it's like this. So is that right?
Okay, the position, the technique, everything is correct. Only thing is we don't have superficial and deep. So like friction, vibration, it is normally done for to bring out the secretion. So it is like deeper only. Okay, so you will be giving it over the lung surfaces, and you will be giving more force. And one more thing to add is you will be giving this vibration whenever the person is doing expiration. Okay, so you ask the person to breathe in, and during expiration you will be doing this vibration. So remaining everything is correct. Then
Okay, thank you.
shaking. Anybody going to demonstrate shaking?
Hello, Miss.
Yes.
Okay. So shaking. Will ask the patient to be in line. It can be supine or front line. Hold the body part and shake. So it's done over the chest, and we will shake and bring forward during the patient expiration.
Okay.
Like this.
Yes. Okay. So it is correct. Depends on in which lobe you have the secretion, you will be giving over that area, and you will shake and bring out the secretion towards the bronchus, and you will ask the person to cough and bring out. So that is a different technique. So when you are learning cardio, you will learn in detail about this particular technique. So vibration and shaking are given to bring out the secretion, mobilize the secretion. Is that clear? So that's why these two techniques have to be done during expiration. Okay, good. Any others like who has practiced for the other techniques? Hacking, ringing. Okay, so we have 5 techniques in Petrosage and 4 techniques in um, percussion. So I'm going to divide you into 9 groups, and I'll give you 5 minutes time. Is that clear? So I'll divide you into 9 groups and I'll give you 5 minutes time. Sharp by 3 o'clock, again I'll close it and you're supposed to demonstrate. Is that clear? So if I divide you into smaller group, it will be more easy for us to demonstrate. Just a minute. Okay, 1 minute. Let me open it again. Okay, please make it fast. So first percussion. Okay. Or like no problem, I will just leave to you. You can just on your video tell the technique you are going to do and you can do it. And please don't waste time, make it fast. I need to go to the next. And I have another meeting also, so I need to I have to close the class little earlier. So please make it fast.
Hi Miss, I'll be doing for the person for the hacking and also beating. So hacking is like this. And then the beating is like this.
Okay. So beating is correct. But hacking, you need to do ulnar deviation and radial deviation. It is not your flexion and extension like this. Okay, it should be, if you do it very slowly, it will be like this. So you can see it will be like this. Okay. So with this three fingers, that is your little finger, then index finger and the middle finger. The three fingers will be used and the ulnar side of the three fingers will be used. Okay, so it will be like this. Can you see? It is ulnar deviation and radial deviation. This is radial deviation, this is ulnar deviation. It is not flexion and extension. It will be like this. Okay. So once you do it fastly, you can feel the three fingers will be touching the patient's body, and don't open up the fingers too much. Just want you for your understanding, I just did like this. You need to supposed to do it, keep the fingers little close and do it. Okay, so when you do it, you can, if you do it on your hand and see, you can feel as if some fibers are coming and hitting you. Okay, so it is like this. Can you see the video clearly?
Yeah, can.
So everybody, it is for everybody. Okay, so it is like this: ulnar deviation and radial deviation. Okay, thank you, Ma. Next person.
Hi, Miss.
Yes.
I'm going to do tapping and cupping. So tapping is like this.
Okay.
Normally apply to a small area. And then for cupping is like that.
Okay.
Normally
Okay.
apply to back. Yeah.
Okay, correct. Next person. So we have completed beating, hacking, cupping, tapping. Any other technique in percussion? No, I think we can go to Petrissage then. So Petrissage, next person, make it fast.
Hello, Miss.
Yes.
I'll be doing exercise for skin rolling. So first, you have to pick up the superficial skin in between your finger and your thumb. And then second, you have to glide in the direction of the movement. Then just repeat.
Skin rolling. Okay.
Yeah.
Okay, correct. But one thing is, when you're doing it for the back, you have to do it like this. Okay, so when you're doing it on your back, you just push and hold it, then you push it back. Okay, while I'm teaching back massage, we will see that in detail, no problem, but correct. Next person.
Miss, we're doing circular kneading.
Okay.
So for circular kneading on the back, we'll be using our hand and do a circular motion.
Okay, good. Good. So in circular kneading, we have some types. Let me explain the types. I think that day I did not explain the types. So in circular kneading, we have this many types. Okay, so one is whole hand. So whole hand is you will be using all the, can you see my video?
Yes, Miss.
Okay, so whole hand means, so you will be using the complete hand and you will be doing the kneading. So while you are doing this kneading, you need to see to that when you are moving, you will be covering half of the other part. So 50% of the area will be covered by next kneading. Okay, so can you see, like when you start from one side, you will be giving the kneading like this to the complete one. Okay, so this is your whole hand circular kneading. Another one is palm. So palm is where you will be using only the palm like this. So for area where you need to give little more pressure, then you can use this palm. So this is also same thing, you will be giving in the circular movement, and you will be covering half of the previous part area. Okay, then finger kneading is using the fingers alone. This is your finger kneading, using the fingers alone. Then thumb kneading is using the thumb. Whole of the thumb you can give. So all these, this is decided by like the surface area you have. So this is your thumb. Knuckle is you will be using the knuckles. Okay, so you will be using the knuckles here. This is your knuckle kneading. Then reinforced kneading is use both the hands and do the kneading. So if you want more pressure, then you can use both the hands and do the kneading. So reinforcing with other hand. So these are the different types of circular kneading. So depending on the area you want to give, you can use it. For example, if you want to do only the face, then you can use finger, then you can use the thumb. Okay, that is for face, but for your back means you can go for the bigger one. Is that clear?
Yes, Miss.
Okay, next. Next one, picking up, bringing.
Miss,
Yes.
I would like to I like to demonstrate technique for compression.
Okay.
Okay, so for compression, one hand over the other hand, and you use your body weight and you compress onto the patient. And then for another type of compression is finger compression. So it's
Okay. Okay, correct. Next.
Thank you.
Picking up and bringing. Nobody is interested to do it. Anybody can do. It is open to all.
Good afternoon, Miss. I'll try to do the ringing part.
Okay.
So for ringing, something like this. Wait. Right.
No, ringing is you need to. Okay. Ringing is something like this. You will be holding the tissue. Then you have to do front and back.
Oh, wait,
For
like
example,
this.
Yes, correct.
Oh, okay.
But when you are doing it, you need to leave the area. Can you see?
Wait. Yes.
So
Miss.
the thing is, you have to hold the muscle. Okay, you have to hold the muscle. You have to hold the muscle, then do front and back. So while doing 1 and 2, you move to the next part. So it will be like a spirally going on. Okay, so don't leave your hold. You will be doing it continuously. Okay, so
Something
hold,
like this,
and the hold is using this area.
Okay.
Don't hold as if you're pinching. You're supposed to hold it using this area.
My pillow very hard to hold. So
Yes, pillow is difficult.
something like this.
Yes.
Yes, sir. Okay.
Yes, good. Okay.
Thank you, Miss.
Next, picking up.
Miss. Hello, Miss.
Yes, Angel.
Yeah, I will do the picking up.
Okay.
Okay, so the picking up is the hand will be in this position and then.
Yes. Okay. Okay, correct. Okay, the thing is, like all the techniques are technique wise, it is correct. You will have little bit changes when you are doing it on a person. So doing it on a pillow, it will not be that much. It will be so much flexible. You will not have that support, or you will not have that hold. That's why you are not getting that complete smoothness. Another one is like you need to keep practicing little more time so that you get the complete smoothness. So it will take some time. Okay, so don't worry, all the techniques are correct. You are going to practice the same thing with the pillows, and like later we will just we have to just incorporate the sequence. So sequence are nothing but depending on the case, or depending on the problem of the person. For example, the person is having spasm, so you can choose the technique which will help you to break the spasm. Okay, so if you want to give the technique for persons who persons who are restless, you want to give relaxation to them, then you can choose the technique, smoother techniques, which will be giving them the relaxation. Is that clear? So the sequence are nothing but how you are going to align the technique. So that is the sequence. So that again, that completely depends on what is the case or what is their problem. Okay, so first, like today, we will just see about facial. I will try to complete as much as I can. No doubt in the techniques, right? Okay. So first is regarding your performer. First thing is you will be given a question. You have to read the question, understand the question, then mentally you prepare the answer. So for this you take at least 30 seconds. Okay, so spend at least 20 to 30 seconds for this. Mentally align the answer, then you start to do the performance. Directly, if you start to do the performance, sometimes what will happen, you may not be able to, sometimes like it will be, you will miss some steps, then you will be skipping the steps. So this will lead to some like the marks will be reduced according to your the marks will be reduced due to that. So you need to avoid all those things. So for that you just frame out a rough outline in your mind. So please spend some time for that. So you can, out of like now we are giving you 6 minutes to do the technique. So 6 to 7 minutes you can do the technique. So in this 6 to 7 minutes, like 20 to 30 seconds you can spend to frame out the answer. Then after getting ready, then you introduce yourself to the examiner as well as to the model. Don't skip any of the steps. So introduce yourself to the examiner as well as to the model. Then explain the procedure to the model. So explaining the procedure means you need to explain 3 things. What is his problem, what you are going to do, and how it is going to help him. Then after explaining these 3 things, you ask him whether he has any doubt. Then if he has any doubt, clear his doubt. Then you get the consent. So you tell him that I'm going to touch some of your body part. So can I get your consent? So get the consent. That's very important. Then after that, you have to check for contraindication. So contraindications, in case if it is your facial massage, so for related to the face, you have to ask the question. Don't, like general contraindication, you can ask like fever, renal problem, cardiac problem. So these are general contraindications. So you can ask that. Then you have to ask related to the part. Okay, so for example, like related to the part, like related to the face, you have to ask in case if you are going for facial massage. So in case if you are going for hand, then related to hand, you have to check the contraindication. Okay, so at least check some 4 or 5 local contraindication related to that particular part. So apart from general, you have to at least check 4 or 5. Then only you will be given full marks. Then, so now we are going to see for face. So we have to position the patient in supine lying. So in supine lying, when you're positioning the person, you have to cover the person properly. Then you can cover the head with a towel or prevent the hair from disturbing from the massage. So for that, what you can do is like you can put a hair band. So you can just put a hairband like this and cover and see to that the hair is not coming and hitting the face, or hair is not coming and disturbing you. So you will be having a hairband like this, isn't it? So you can just put the hairband like this, and you can cover up the remaining part by a small towel. Okay, so this is for your preparation for the patient. Then you have to prepare yourself. When you are preparing yourself, you should not have any nails. So it's very, very important here. So for massage, if you have your nails and nail polish, then the examiner will disqualify you. So before your exams, make sure that you cut your nails, you remove your nail polish. Okay, so no nail polish, no nails. So if you have nails, then it will be hurting the person. So make sure that you don't have your nails. Okay, so remove everything. Then remove your watches, remove your rings, because like you should not have anything in your hand. If you have anything, it will be rubbing the patient and it will be hurting them. So this is preparing yourself. So first is like you have to position the patient, then you have to position yourself. For face, you are supposed to either sit like this, like behind the head, or you can stand behind the patient like this. So this is the position for facial massage for the therapist. So the patient will be in supine lying. You can apply a hairband and you can cover the hair so that it is not hindering your face. Okay, second thing, you have to prepare the patient. So preparing the patient is covering the patient with a towel, covering the patient's hair, and it is not disturbing you. So that is your preparation for the patient. Then position of the therapist is either you can sit behind the patient's head, or you can stand behind the patient. Okay, so this is therapist position. Then preparing the therapist. So you should not have any nails, you should not have any nail polish, you should not have any rings, you should not have any watches. All those things you have to remove. So remove everything. Okay, then next is, so this is for your back. You have to be in a walk standing position. Okay, so this is your walk standing position. So for all other, except your face, for all other massage, you need to be in a walk standing position. So why walk standing position? That only will help you to move around. So that's why you need to you need to be in a walk standing position. Okay, so now we will go into face. So after preparing yourself as well as after preparing the patient, then you have to see, like you can see, like can you wash the pillow clearly? Can you watch it clearly?
Yes, miss.
So you can just imagine this is patient's face. Okay, this is patient's face. You are sitting behind the patient. So you have to apply the powder. Don't, like, not on the face. You have to keep the hand down to the cot. Apply the powder. Then do like this. Just to show you, I am showing here. But you are supposed to do under the cot. Okay, so apply powder. Then do this movement so that the complete hand is dusted with the powder. Then you can go for touch. So since it is face, you can go with the finger touch. So you can touch the patient face like this so that they are getting used to for your touch. So this is your touch. Then start with stroking. So stroking you need to do from proximal to distal. Okay, so proximal here, this is the head part, this is the chin. Okay, this is hair, forehead, and this is chin. So you start from here. Okay, so stroking is, you can just see this is stroking. So start from here, from forehead and go down. Then come back, forehead and go down. Come back, forehead and go down. So 3 times you have to do. Then the remaining area. So under your eyes, then to the chin. Under your eyes, then to the chin. Okay, so this is your stroking. Then after stroking, you have to start with effleurage. And this effleurage have to be given in between every technique. So in between every technique, you are supposed to do the effleurage. Okay, so effleurage here, if you see, always the effleurage will be given from distal to proximal. That means from the chin you have to go to the forehead. But since the lymphatic drainage is at the neck, at the cervical neck, you cannot drain the fluids in the forehead. There is no lymphatic drainage in the forehead. So that's why you are going to drain in the cervical area. So you start the effleurage from the forehead and you are supposed to go down and drain out. Okay, so start from the forehead, go down and drain it. Start from the forehead, go down and drain it. Then 3 times you do, then you can go cover up the, leave the eyes, don't give pressure over the eyes, then you cover up the chin and go down. Okay, so this is your effleurage. So let me show you in my face. So you just imagine I'm in a supine position and the therapist is standing behind. So you will start the stroking. So from proximal, you will be giving the touch like this, spreading the lubricant all over the area. Then stroking like this, come down, then go back, come down and go back. Then you can also cover up this area. Okay, cover up here, then come down to the chin. The next is effleurage. So effleurage, you will be starting from here, drain out, then with the thumb you have to drain out completely. Since this is very small, you can also go for the thumb effleurage. So the part is very small, so you can also go for thumb effleurage. Okay, drain in the chin, then go back. Then second time, drain in the chin. Third time. Okay, then after 3 times, then you can cover up the next. So this area. Okay, drain out down. Then go back. Then again from forehead, then under the eyes, then come back down. Okay, so this is effleurage, and this effleurage you need to give in between all the technique. Then next you can see, like, you can go for tapping. Okay, so you can go for tapping. Okay, you can go for circular kneading like this. So everything you start from distal, cover up the whole area, go to the forehead. Okay, so this is your circular kneading. So if you want to go for the finger kneading also, you can do. This is finger kneading only I am doing. You can also use your thumb to do the circular kneading. Then you can go for hacking. So hacking normally is done over the muscular part. So here in the chin, in the forehead and all, you won't have that much muscular. So you can give hacking over the chin, cheeks like this. Okay. Then if you want, you can also go for bringing. Okay. So you can also go for ringing. Then another thing you can do is you have a different stroking in the face that is called over the orbit. Okay, like this. Over the eye orbit you can do another stroking. This is a modification only for your face. Okay, then you can give compression like this over the eyes, then over the cheek. You can go for compression. You can go for friction over the orbits, like over the bony areas you can give friction. So over the eyes you can go for friction. So you can also go for transverse friction like this over the orbit, over the lower orbit. So over the cheek area you can also go for circular friction or transverse friction, you can do it. Okay, so you can just imagine, see what are the techniques you can do. So these are, I think I have covered everything. So these are almost all the technique that you can use it for your face. So in between each technique, you are supposed to do the effleurage. Don't forget that. So at least in between 1 or 2 techniques, you do the effleurage. Then later on, you can inform the examiner that you will be doing effleurage in between all the techniques. Okay, then. So in face, these are the maximum things you will be able to use. So in the facial massage, you will be getting 2 types of question. One is like the person is having a Bell's palsy and the person is not able to close his eyes and the mouth is deviated towards the sound side. This is one of the problem that is called as Bell's palsy or facial palsy. So this problem is occurring because the person is traveling in, you might have like you will be reading in electro, if the person is traveling in a cold climate, if the cold air is going inside the ears, it may cause some ear infection, and behind the ear, your facial nerve will be getting compressed, and because of that the person will be getting Bell's palsy, or the infection might have spread to the cranial nerve, that is like facial nerve, and that also will lead to facial palsy. So when the person is having this problem, they will not be able to use one side of the face. So one side, for example, if right side is affected, then left side of the face will not be used. So the muscles here, it will not be able to function. So when it is not able to function, the eyes will remain open. they will not be able to close the eyes. So eyelids will remain open. Then the mouth will be getting deviated towards the sound side because you have buccinator muscle which is pulled on both sides. When one side is not working and one side alone is working, what will happen? The mouth will deviate towards the sound side. So these are the symptoms the patient will be having when they have this Bell's palsy. Okay, so for this particular problem, you will be able to give this facial massage. So when you are given this kind of question, you can, it is enough if you just do massage on one side of the face. You don't need to cover up the complete face. You can just do on the affected side. And when you are doing on the affected side, only one point you have to remember is, since the eyes are not able to close properly, it will be remaining open and the mouth will be deviated towards the sound side. So when you are doing effleurage, you need to pull the mouth upwards. And when you are coming near the eyes, you have to reduce the pressure because already this muscle is pulled upward and it is not able to close the eyes. Is it clear? So when you are doing effleurage, you have to give more pressure in the lower quadrant. When you are coming to the upper quadrant, you will be reducing the pressure. Then when you are coming down, you need to give more pressure in the upper quadrant because it will help you to close the eyes or pull the muscle downwards. Then when you are coming to the lower quadrant, you have to reduce the pressure. So this is the only one modification you need to do for Bell's palsy. Okay, so I repeat again, you need to do this modification during effleurage because in Bell's palsy, the mouth will be deviated towards the sound side. So that means the mouth will be deviated towards this side. Okay, the eyes will not be able to close. So the upper quadrant will be pulled upwards. So when you are doing effleurage, you will be starting from distal, you will be starting from the proximal. So here when you are coming down, you will give more pressure. When you are going to the lower quadrant, you will reduce the pressure. Then when you are going back, you will give more pressure so that the buccinator muscle is pulled upwards and you don't increase the deformity. Is that clear? So this is for your Bell's palsy. In case the other condition is, they can ask you to do facial massage to improve the skin tone. So if they ask you to do the facial massage to improve the skin tone, then you have to cover up the whole face. So you have to cover up the whole face. Then you don't need to modify anything. You can do as normal. Is that clear? Check whether.
Yes, Miss.
So these are the example things I have given here. So you can use this example like, but again, if you feel that if you want to use some other technique, if it is justifiable or needed for the condition, then you can use it. So this is for your facial massage. So I stop here because I have a meeting by 4 o'clock and I have to prepare something for the meeting. Okay. Then tomorrow we will not have class. We will have class on Friday afternoon. I hope you are free on Friday afternoon. Okay, because tomorrow again I have exam duty, so I'll not be able to take the class. So we will. I will send you the invitation on Friday afternoon. Is that okay?
Okay, Miss.
Yes, Miss.
So Friday afternoon we will try to complete this portion so that during the weekend you can practice this and you can master the technique. So you start practicing the facial massage from today. Okay, so don't call your sister or brother and start practicing on their face, because sometimes when you do massage, it may increase circulation and you may increase their pimples or acne. Is that clear? So don't practice on their face, practice on the pillow. The later, once you master everything, then you can do it on their face. Is that clear?
Okay, Miss.
Yes, Miss.
Okay, thank you.
Thank you, Miss.